Hello, this is Squeeze Your Brain 2, an indication of points in TCM. I'm Dr. Marini, Dr. M. As usual, we start with an easy question. So which point is the HC of the stomach channel? A, stomach 36, B, stomach 34, C, stomach 40, and D, stomach 41. The answer is A, stomach 36. Also, we can call the lower HC of the stomach channel stomach 36. So we have the regular HC, and in the young channels, we have the lower HC in addition. The three in the legs, gallbladder, urinary bladder, and stomach are the same. The young channels in the hand have the regular HC close to the elbow and the lower HC close to the knee. So the answer in this case is stomach 36, the HC of the stomach channel. Question 2. Now we have to answer why. Which point is indicated for fire in the stomach channel, toothache, nosebleed, skin problems, and why? A, stomach 38, B, stomach 44, C, stomach 35, and D, stomach 45. Take your time. The answer is B, stomach 44. And the reason is because stomach 44 is the water point in the stomach channels. So water can treat fire. And the indication that we're talking about was fire in the stomach channels. Remember that. Water points can deal or can treat fire. Question 3. Which is the best point for promoting lactation and why? A, stomach 34, B, small intestine 3, C, heart 5, D, small intestine 1. Okay, there can be another answer, like a small intestine 3 or maybe stomach 34, according to some books. But the main point to to promote lactation is a small intestine 1. The answer is D as a David, small intestine 1. And the reason is because the small intestine 1 is the yin well point. These points are indicated for fullness below the heart. And also remember that there is a branch of the small intestine channel that reaches the breast area, especially in the center of the chest. So the center of the chest we can find REN 17. So small intestine 1 in combination with REN 17 are the most important point in this combination in order to promote lactation. Okay, this could be a tricky question. Which is the best point to treat a patient with dysmenorrhea and pain and itching of the skin? A, spleen 8, B, spleen 10, C, spleen 6, and D, spleen 4. Now, take your time. Don't cheat. The answer is spleen 10. Take this in consideration. Spleen 8 is the best point for dysmenorrhea. This is the main point, the spleen 8. But spleen 10 also can treat dysmenorrhea. Okay, now both can treat blood disorders. Now, spleen 8 is the chi cleft of the spleen channel, so also can deal blood disorders. But when we're talking about spleen 8, again, the main point for dysmenorrhea, it can treat also abdominal masses or abdominal pain. But when we talk about skin problems, right, we have to work with the spleen 10. The spleen 10 is also a very good point for blood disorders, for example, blood heat, blood stasis. But when we had a patient with dysmenorrhea, the difference between spleen 10 and spleen 8 is spleen 8, the best point for dysmenorrhea, is more related when the patient also can have abdominal masses or abdominal pain. And spleen 10 is when the patient also can have skin issues. Spleen 10 is very popular, besides this condition, to treat blood stasis and heat in the blood. Question 5. Which is the best point to treat headache in any location of the head? A, A, small intestine 8, B, stomach 8, C, stomach 44, and D, GV 41. We can use any of these points in order to treat a headache. We haven't studied GV channel yet, but a GV41 could be a good point to treat headache. But among these points, the only one that can treat headaches, no matter the location of the headache, no matter the location, is stomach 8. And the reason is something that I will tell you when you enrolled in the class. Follow-up question: which point is the best for dampness in the whole body and why? Why spleen 6 is a good point for dampness in the lower jaw? Which is the best point for tonification, chi, and blood and why? Why a small intestine 3 can treat back pain? What is the empirical point for shoulder pain and why? It's a good point in the spleen channel to stop bleeding, and what technique would you use in case of deficiency, like a Chi deficiency, or in case of excess, like a blood heat? If you want to learn more, you can find me in teachable.com. This class is indication of points in TCM, and you can find the link below in the box. I'm Dr. Marini, and I hope you enjoyed this video.